All right, so we're getting started with the live stream. Thank you all for joining. I wanted to take some time before October is over, is quickly winding down to discuss breast health. And so the title of this presentation is Lifestyle, Metabolism, and Modern Breast Health from Awareness to Action. It is my hope that by the end of the talk today, you have some actionable steps that you can take to improve your breast health. So this slideshow will take about 10 minutes. Please, if you have questions in real time, ask them. I have the chat box up so we'll be able to discuss and we'll go from there. Yeah, advance this slide. So let's see. This is Health Awareness Month. I know we commonly call it Breast Cancer Awareness Month, but I wanted to flip the script. Let's talk about things that we can change. Let's talk about things that we have control of and things that promote the health of our breast. There's got to be a better way for me to advance these slides, but this is what I'm going to do for right now. I often go back to this quote by Dr. Maya Angelou: when you learn, teach. We know that things in healthcare and medicine are changing. We have new research available to us almost every day. And so, what I try to do as a primary care physician, as someone who is a lifelong learner, is I take from the research and I translate it into what can help us, me included, into actionable steps. So as I learn, I teach. And then I also learn from you all because we have all these sources of information and we're trying to do the best that we can with the information that we have. Now, breast cancer facts. We know that this is the number one cancer for women worldwide. About 1 in 8 women will get breast cancer in her lifetime. And that translates to women having about a 12% risk for breast cancer over the course of her life. And about 9% of all new cases occur in women less than 45 years of age. And so we see it affecting women younger and younger. Almost 10% of new breast cancer cases are occurring in women less than the age of 45. And so when I hear women say that they want to wait to get a mammogram, that is missed opportunity for early detection. Or they may want to wait till 45 or 50. We need to start screening at age 40. And then what I'm going to be focusing on a lot during this time together is the missing link of lifestyle and metabolism. Our everyday choices affect our breast health, and that is what I'll be highlighting today. And we do detection pretty well. We know that there is screening with mammograms and sometimes with other imaging like ultrasound and MRI, but I want to focus more on prevention today. There are things that we can do to lower the risk. When we talk about risk factors, there are modifiable risk factors and non-modifiable. The non-modifiable meaning things that we cannot change. We cannot control our gender, our sex, our age, our genes. We can't control our family history, but we can control our level of physical activity, our nutrition, our alcohol consumption. So I will focus on the modifiable risk factors today. With screening, different bodies of experts have different recommendations. The USPSTF is the organization that a lot of us primary care providers, specialists use, and it's what a lot of insurance companies follow. And so it is recommended that women get a mammogram every 2 years, starting at age 40 to the age of 74 by this body. But in practice, a lot of providers, including me, recommend annual mammograms starting at age 40. And then if a woman has dense breasts, that's what I see most commonly on reports. Dense breasts. So then there will also be additional imaging with ultrasound or MRI. And then some women may need genetic testing depending on their family history or personal history of radiation to the chest area. And then this is the thing. 90% of women that have been diagnosed with breast cancer do not have family history. When I'm talking in the office about breast screening, I'll often recommend screening. And then I'll commonly hear women that don't want to be screened say that they have no family history, so they should be okay. But we know the vast majority of women that are diagnosed do not have a family history. So there's a lot going on. There are spontaneous gene mutations, meaning it wasn't in the family, and then something happens with a woman's DNA, and then they can have a new onset of cancer, or it's even the interactions that we have with our environment. We'll get into this, but we are living in a world like like never before. And so our exposures to toxins in the air and our foods and our cosmetics and our clothing are different. So the majority of women do not have a family history. So what we're going to focus on this morning is breast cancer risk reduction. I often say this is the hardest conversation I have to have with people throughout the day. Reducing alcohol intake. Alcohol is the most consistent risk factor for breast cancer. Even one drink a day can increase a woman's risk by 10%. And the relationship between alcohol and breast cancer is linear dose response, meaning the more alcohol, the higher the risk. There's no safe threshold. So sometimes depending on what we're counseling on, we'll say women can safely have one drink a day, men can have two drinks, but as it relates to breast health, there is no safe threshold. And the reason why alcohol affects breast tissue negatively is that it increases estrogen. It increases estrogen in the breast tissue via the hormone aromatase. Aromatase is the hormone that converts testosterone to estrogen. It happens naturally in the body, but the more alcohol exposure, the greater the aromatase activity and the greater the estrogen level. And then alcohol damages DNA. I mentioned briefly that a lot of these new cases of breast cancer, meaning it wasn't in the family and now it's appearing, is because DNA is damaged. And alcohol is one of the toxins that can damage the DNA. And then also alcohol depletes folate. And so the next slide is something that I have posted. I posted it a couple of years ago. I just like the way it's depicted. The more you drink, the higher your risk. And so one drink a day increases the risk about 7 to 10% compared to a non-drinker. 2 to 3 drinks a day increases the risk anymore. So it's dose dependent. And then at the bottom, it's kind of small in the writing, but I wanted to find what a drink is, because depending on who's pouring, there can be some debate. But as far as what research shows, one drink is about 5 ounces of wine, 1.5 ounces of a hard liquor, or 12 ounces of beer. So even wine counts as potentially causing harm for the breast. I often say that they shouted, whoever they are, they shout the message, drink wine for the heart, drink wine for your health. But they whispered the message that alcohol is a toxin. And so this is a hard conversation I have, because a lot of people, drink alcohol socially. It's a part of life and it's a part of cultures for some, but it is not the best thing for breast health. So that is one of the modifiable risk factors. Decreasing the alcohol intake can help protect the breast. And it's the one that research shows over and over. Now, the second one is physical activity. I do have some notes here. I'll make sure I follow along. But physical activity and body composition, we commonly recommend 150 to 300 minutes per week of moderate activity. That will protect the breast and lower the risk for breast cancer. And then we encourage adding 2 days a week of strength training. So anything that builds muscle. I tell people all the time, you don't have to go to the gym. I do most of my workouts, most of my workouts at home, unless I'm walking outside on the trail. But you can get free weights and do bicep curls, tricep curls, chest press, squats with the own body weight. That is strength training. And you want to aim for at least 2 days a week. I commonly say that we are as young or as healthy as our muscle mass. And muscle is its own metabolic hormone, own metabolic organ. And so you want to build your muscle mass. And then working out is important, but this NEAT, which is defined as non-exercise activity thermogenesis, means just movement. So yes, exercise, but then also be physically active, move more. That can be laundry, housework, playing with pets, playing with children. or even just periodically standing throughout the day. We commonly hear that sitting is the new smoking. We want to be as active as possible throughout the day and build muscle because muscle is a metabolic organ. And the reason or the ways that physical activity is protective is that the more muscle you build, the better your insulin sensitivity. Insulin and IGF-1 drive cancer pathways. And so if we can decrease the insulin resistance, especially through exercise, that will help protect against breast cancer. Exercise also decreases inflammation, and with exercise, you lose weight. So, adipose tissue that you see on the slide is a fancy way of saying fat tissue. And fat tissue is its own metabolic organ. That means fat tissue is producing hormones, mainly estrogen. So, the more fat tissue, the more estrogen. And as I mentioned earlier, we wanted to have a better estrogen balance. And so one way to achieve this is through weight loss, and that is protective of the breast tissue. And I'm keeping my eye on the chat. If there are any questions, please interrupt me or any tips. I do want to say that women with a higher level of physical activity have a 12 to 21% reduced risk of breast cancer. So that's pretty significant. And that is something in our control. And I encourage people just to start where you are. It's not about going from sitting all day to running a marathon. It can look like taking the stairs or parking further away. And there's also research that shows that physical activity during adolescence has the greatest impact. And so there's a lot that goes into that, into set point. I recently released a video about set point and weight management, but we know adolescence is a time where it's very important to set healthy habits and to also have a healthy weight. And so we want to make sure that our young people are moving and are physically active. The next thing we're going to highlight as far as it relates to lifestyle is the breast protective plate. There's plenty of research that shows that Mediterranean style and pattern is best for the breast, best for breast protection and reduction of breast cancer risk. And this picture highlights some of the key points in this style of pattern, this style of eating. Extra virgin olive oil lowers risk. I'll have a recommendation for dosing at the end. Fibers that bind estrogen, here we're talking about estrogen again, help decrease reabsorption. And so when we increase our fiber intake, it is easier to excrete estrogen in the stool. Otherwise, estrogen just gets reabsorbed. So we want to release it. When I'm talking to people in the office about their health, I'm even discussing frequency of bowel movements because we know that that is one of the ways to get toxins are just to help restore balance of hormones. Omega-3s, cruciferous vegetables, and phytonutrients are important for breast health. Cruciferous vegetables are vegetables like broccoli, cauliflower, Brussels sprouts. They are full of the components that help us balance estrogen. And when people have an issue maybe getting enough cruciferous vegetables, there are supplements like DIM, which is cruciferous vegetables in capsule form, and that can also help with the hormone balance. And then omega-3s are found in fatty fish that we see in the picture, like wild-caught salmon. It's important when you're choosing your fish for it to be wild-caught. The wild-caught fish are the ones that are eating the algae and the seaweed, and that is how the fish become a source of omega-3. Otherwise, if it's farm raised, you're not going to have the same health benefits. And then I encourage the intake of whole grains and legumes to help balance blood sugar. The way that the breast protective plate helps promote breast health is by reducing oxidative stress, decreasing aromatase activity. That is, again, that hormone that is converting testosterone to estrogen. So that helps with the hormone balance. And then it improves the gut health because we know gut health is important for whole body health. So soy, I see a lot of back and forth. Is soy good? Soy is good. The whole food, not the ultra processed, but soy itself is good for protection of the breast, and it lowers the recurrence of breast cancer. Dairy, the research is plus minus neutral to slightly protective, but it really depends on how processed and even what was the animal fed that produced the dairy? We're as good as what we eat ate. Meaning, I mentioned eating wild caught fish. You want the wild caught fish because that's what ate the algae. But if we're eating things that did not eat good things, then those not good things are in us. So we are as healthy as what we are eating, what it ate. And then we know ultra processed foods are no, it's not good for any kind of health, especially breast health. That increases the risk of cancer and it increases inflammation in the body. Now, what I love to talk about metabolic health. Metabolic health is how well we process the food we eat. We need to turn the food we eat into sources of energy. When we don't do it well, it shows up as high blood pressure, high blood sugar, high cholesterol, and weight along the abdominal area. When we do it well, blood pressure is good. Um, Thank you. What about soy milk? Soy milk can be a good source of soy. Yes. So thank you for that question. Now, I will say, if you're going to drink soy milk, you want to choose the one without the added like sweeteners, flavors, because sometimes even though we're getting good things, if it has a lot of additives, so get the cleanest products possible. So thank you for that question. So when we don't have optimal metabolic health, it shows up as the things that create metabolic syndrome, which is diabetes or unhealthy blood sugar, high blood pressure, increased abdominal weight or circumference, and then high cholesterol. And so what I'm describing are things that are very inflammatory. When insulin is high, which is the precursor to metabolic syndrome, and IGF-1 goes up, then mTOR goes up. All these things increase cell growth signal. What cancer is when cells become abnormal and then they just keep dividing. That is what creates tumors and then creates cancer. And so insulin drives all of that. It drives this proliferation or this cell growth and division. Metabolic syndrome increased risk, mortality, and recurrence of breast cancer. And so we know there's statistics out there that people with diabetes or high blood pressure have a greater risk of breast cancer, and it's because of this pathway. And it's also greater, and there's a greater waist circumference. And so to help improve breast health, we really need to focus on improving metabolic health, improving insulin sensitivity, and that is through optimization of glucose. The things that we discussed earlier, the physical activity and the nutrition choices help optimize glucose. It's all together. The triglycerides and HDL are two components of the cholesterol that are looked at with metabolic syndrome. It's interesting. When we look at cholesterol panels, there's a lot of focus on total cholesterol and LDL. But when we're defining metabolic health, we're looking at triglycerides and HDL. HDL is the good cholesterol. I often say it's happy. We want it to be high. It is a protective cholesterol. And so those are the two components that we're looking at when we're looking at metabolic health. And then the last thing is an insulin resistance calculation, but it is to show how insulin sensitive or resistant an individual is. Insulin sensitivity is a spectrum. It's not just you are. Insulin goes up before blood sugar goes up, but there's a calculation that we can do to assess a person's sensitivity, and those things that glucose, the cholesterol, the waist circumference are things that we're using to measure metabolic health. And then to reset the metabolism, want to increase movement, as we've discussed, increase fiber, as we discussed, and choosing healthy fats. And that was displayed on the picture, like things like olive oil, avocado, those all help with metabolic reset. Circadian rhythm. Ooh. Okay, so this is very interesting to me. Circadian health. So disruption of our 24-hour clock can lead to hormone and repair dysregulation. I saw somebody this morning. We're all on lunch break. A lot of us are. And so I was talking to somebody this morning with the high blood pressure. So that's a reflection of metabolic health. My first question was, oh, did you work last night? because I have a lot of patients who are working in healthcare or working jobs that require 24-hour service. And whenever there's a disruption in that clock, that's defined by wake sleep, that can lead to hormone issues and DNA damage. And so, circadian health is really important for all health and especially breast health. We know from research that night shift work is a probable carcinogen, meaning night shift work probably is a cancer causing thing. But there are actionable guardrails for better circadian health. Again, it's going to be, my message is pretty much the same all the time: optimize glucose, cholesterol, waist circumference, insulin sensitivity, move more, eat fiber, healthy fats. There's also research, I do want to mention this, that circadian eating plays a role. We need to have at least a 13-hour fast, meaning when you stop eating in the evening, don't eat again until 13 hours later, at least 13 hours. That goes into a whole different topic, intermittent fasting. That's a whole different topic that we can discuss another time. But our guts need time to rest. So that's circadian eating. We really want to decrease the snacking through the night. And if you choose to eat breakfast, you want to break your fast after at least 13 hours of not fasting. But that has been shown to have at least a 21% reduction of breast cancer death. And then also, there's another statistic I want to share with this slide. Postmenopausal women that sleep less than 7 hours at night had an increased risk of breast cancer. So those things that we're finding in research show that circadian health, our relationship between timing and eating and sleeping, play a role in our metabolic health and our ability to repair damaged cells, repair DNA, because sleep is important, because that is the time for repair. That is when our body is resting and going through renewal processes. Survivorship, let's talk about it. So if someone has been diagnosed and they want to reduce the recurrence, what helps? Physical activity. Can't go wrong with it. Can't go wrong. Healthy weight. So obtaining that healthy weight, reducing waist circumference. And I do want to say, a lot of times with healthy weight, we pay attention to BMI, so the body mass index, which is a calculation of weight for height. But it gets tricky. We do want healthy weight, but we also want a healthy waist circumference. And that is defined as a waist circumference less than 35 inches. Although there is research and real life experience that number should be, I hardly ever use that word, but it should be different depending on ethnicity, because some ethnic groups, and particularly Black and brown people, have higher muscle mass. And so when we're looking at weight, we have to take into consideration if the weight is higher because the muscle mass is higher. We've already said muscle is protective. It's its own metabolic hormone, and you're as young as your muscle. So that's why I like to focus on waist circumference more than the number on the scale. We want a lower waist circumference and good muscle mass. Plant-forward diet. The plants, as I mentioned earlier, help balance the hormones, and they're a good source of fiber. And limit alcohol. It says limit here, but if you could just totally not drink, that would be best. But for sure, limit alcohol. There have been studies that looked at the efficacy of metformin, because metformin is a medication that we commonly prescribe for PCOS, prediabetes, and diabetes. It does improve insulin sensitivity. And so in thinking, that should translate to helping with breast cancer, protection against recurrence, but that has not been shown in the literature. But there are some people who use it in that sense. And then aspirin has been shown just to help with reduction of certain cancers, and particularly colon cancer, but we have not seen the benefit in the research for breast cancer. But the WCRF stands for the World Cancer Research Fund. The update this year is lifestyle remains the cornerstone to prevent recurrence. Lifestyle goes a long way. And so as we are thinking this month and beyond about Breast Cancer Awareness Month, I wanted to just highlight the awareness to what we can control, our daily life choices, our lifestyle choices that can help protect our breast. And so this is something that we can all start doing today. if we're not doing it already, daily movement, adequate fiber. It is very difficult without intention to get at least 30 grams of fiber. The average adult in this country and probably around the world is not, maybe gets in the low 20s. So we want to make sure we have adequate fiber to help balance those hormones. Extra virgin olive oil, so a healthy fat, whether it's olive oil or avocado oil, you want daily intake of the oil. And things like olive oil, you don't have to only cook with it. So, like, let's say you're eating the broccoli, you're getting your cruciferous vegetables, you can drizzle olive oil on after it's cooked or after it's steamed or sauteed, and you can get it in that way. And so, certainly can eat olive oil raw. And then you want to limit or reduce or eliminate alcohol intake. Aim for a smaller waist, circumference, sleep. Go to sleep at night. You can talk another time about like sleep hygiene. We want good sleep at night, at least 7 to 9 hours, to respect that circadian rhythm and give the body time to repair. And then adequate vitamin D. I did not talk here about vitamin D. I put a video out recently on Instagram and Facebook about vitamin D and what the research shows with breast health. But vitamin D plays an important role. And so the normal range for vitamin D is 30 to 100, but optimal is much higher than that. And so I encourage people to get their numbers checked and get adequate levels. This is my last slide. Prevention is the new pink. Please share this with someone who may need it. And also, I'm back in the swing of things. I'm producing information because there's a lot. And I want to, again, say it is my goal to translate what works from research, from experience, into things that we can do to take ownership of our health and to protect our metabolic health, which will protect our health in general. And so please join me here on Instagram, on Facebook, just for little tidbits along the way. And I look forward to connecting with you all. Thank you for joining me here. Are there any questions or any additional questions? I will say that next month, which is here like in 3 days, is Diabetes Awareness Month. So public seminars. Yes, I don't, but I would like to. So would what would be, or something in person? Are you local? Or maybe Zoom or YouTube? Any suggestions? You can always message me. In the past, I've spoken at churches, at schools, at health fairs. Okay, yes. Let's just connect, make something happen. I was thinking last night, like, why am I doing this? Like I was just checking in with me, but there is just so much information, and most of it is probably good, but I think that things need to be done in context. And there are so many things that we can do in our daily choices to really help promote our health and improve our self-efficacy and stuff. So you're welcome. I appreciate you all joining me here, and this will be up after I end it. And just keep pressing forward. But yes, thank you for your support today, your participation, and I look forward to connecting again soon. Oh, excellent. I can't pick up who you are, but if we're in, maybe if you could message me on Instagram or call the office. Yes, let's connect and yes, that's powerful. 2-time survivor. So that's excellent. All right. Thank you all. I'm going to end the stream, but I am Dr. Keita Evans on Instagram, on Facebook. I have a page. Thank you. On TikTok here. And then my office number, I'll put it in here. I work in Atlanta Metro. 770-680-2949 is the office number. And then I'm putting the practice website here. I've been in practice in Georgia. I moved to Georgia in 2011, but been at Healthy Medical Center since 2019. So I'd love to connect with you all outside this platform. But thank you for joining me today. You all take care.